Good morning, guys. In recent years, hair transplantation techniques are evolved, and because of excellent equipments, techniques, procedures become so easy for patients rather surgeons. I mean to say, procedures are just kind of a very fast recovery, safer to do undergo. But while there are few patients always has a doubt, if so, why most of the people are not getting it done? I've seen a guy neighbor to me, he had baldness, but he did not go through a transplant. And I've seen a couple of celebrities who was not bothered about getting it done. Why? This is a question everyone has it. The basic question is, can everyone undergo a transplant? So to give some light on this, I really wanted to make a video. Kindly just watch the video until end to understand what are the basic reasons that one can go with the transplantation. Can everyone undergo transplantation or not? There are a few factors we need to consider before taking one to transplantation, because these are the important factors to decide your outcome. So transplantation can be done for everyone, but with good outcome, with a good prognosis is the most important goal in this undergoing the transplantation, right? So number one is the age criteria. Though there is no strict restrictions on the age, usually we recommend age about 25 because they have a lot of ongoing hair loss and their baldness is not stabilized. In the sense, if you consider transplantation age 23 who has an ongoing hair loss or hair fall, we don't know his future hair loss pattern, baldness pattern. That is the reason we don't do a transplantation in youngsters. Whereas a rare instance, like someone has already gone completely bald, age of 22. Imagine 22 years he lost all his hair, nothing to lose anymore. Then, if nothing to lose any hair in the future, for such people, definitely they can undergo transplantation even age less than 25. So that is the age criteria. Number two is someone has male pattern baldness but having no donor or less donor or poor donor. So we all know that backside donor is that plays a crucial role in a transplantation outcome. Of course, we can also go from the beard and chest graft, but predominantly we have to have scalp grafts. So someone has a poor donor or a weak donor. For such cases, irrespective of the age, we cannot do transplantation. Even for them, if you do, probably you get kind of a failure transplant results or a poor outcome, or even at times no outcome. So someone has a no donor, poor donor, we cannot consider transplantation. So reason three is diffuse pattern hair loss. So diffuse pattern hair loss means partially having the hair fall, and some areas you got thin hair. There is ongoing hair. So such patients, if you do transplantation, probably future hair loss can happen and lead to poor growth or undesired results. Such patients, we cannot take them for the transplantation. Well, and there are a few instances. Then what we can do is imagine stabilized diffuse patterns. That means they have a very thick donor in the backside, but front side which is very thin, which has been like that a couple of years. No more further hair fall is anticipated for them. If they are above 25, we can definitely again consider doing the transplantation in that patient, in such patients. The last reason is general health. That could be any serious health elements like heart problems, kidney problems, any systemic health problems, or local health conditions like skin infections. Those kind of people, definitely we cannot take them for the surgery. While such patients, usually, if we can identify earlier, maybe we can just get them treated and then go for the transplantation. These are the four main reasons why everyone cannot take transplantation. And well, there are many a number of reasons that where we cannot take them for the transplantation. But these are the four main reasons we have to think about it. So these kind of people, they cannot undergo transplantation. Conclusion of this video is, well, there could be any reasons, many number of reasons like why one cannot go with the transplantation. But actually, you have to see a best surgeon to undergo thorough examination, assessment and evaluation of your scalp to decide whether transplantation can be planned or not. It's not the question of only doing surgery, it's a question of what kind of prognosis you are going to get it. So there are few exceptions with the age, there are few exceptions with the diffuse pattern type, there are few modifications that can be done for the health ailments, and still we can do the transplantation. Well, overall, if you don't have a good donor, you are a poor candidate for the transplantation. Other things can be modified according to your case scenario. So, well, once you see the good surgeon, we can assess and evaluate your scalp and suggest you better plans whether transplantation is suitable or not with good prognosis, and also is there any modification that we can do for your case. So these are the few things you have to understand. So otherwise, transplantation is a safer procedure, and if you are a good candidate, it definitely helps you to get a good prognosis and good desired results.